Hello, I'm Dr. Nancy, a health educator focused on brain longevity and practical prevention in midlife and beyond. Today I want to talk with you about a quiet risk that often hides in plain sight inside our medicine cabinets. For many adults over 50, the most harmful everyday exposure for brain health isn't sugar, screen time, or stress. It's a certain kind of medication load that silently interferes with attention, memory, and mental clarity. The name is a mouthful, but the idea is simple: anticholinergic medications. You don't need to memorize the word. You only need to recognize the pattern. These drugs block a messenger chemical in the brain called acetylcholine, which helps you store new memories, stay focused, and coordinate the smooth, automatic tasks your body performs all day long. When the blockade is strong or adds up from multiple products used together, people often describe the same experience: fogginess, word-finding issues, confusion at night, and a slow, dull feeling that makes thinking harder than it needs to be. Over years, a high anticholinergic burden has been linked with a higher risk of cognitive decline. The good news is that this is one of the most modifiable risks we have. You can't change your genetics, but you can audit your bathroom shelf. Let's make this clear from the very beginning. No single pill automatically causes dementia. That's not how the brain works. But long-term, cumulative anticholinergic exposure can nudge the brain in the wrong direction, especially when combined with other stressors like poor sleep, inactivity, loneliness, and unmanaged blood pressure. Think of it like carrying a backpack that slowly gets heavier every month. One small item isn't a problem. 10 small items become a weight you feel with every step. Your job isn't to panic or blame yourself. Your job is to get curious, lighten the load, and choose safer, smarter options whenever possible. What makes these medications so sneaky is that they appear everywhere and under many familiar names. Nighttime sleep aids that promise gentle rest. Allergy tablets you grew up with. Motion sickness tablets you take for travel. Overactive bladder pills that help with urgency. Certain older antidepressants and anti-nausea pills. Muscle relaxants kept in the cabinet from an old injury. Even some cold remedies designed to dry up a runny nose rely on anticholinergic effects. If you ever noticed that a pill helps you sleep because it makes you dry-mouthed or a little woozy, that's the same system at work. Short-term, the drowsiness can feel helpful. Long-term, that sedating, drying effect is a sign your brain's memory messenger is being blocked. I want you to understand the why in the simplest possible way. Acetylcholine is like the green light that tells your brain cells to pass information along quickly and efficiently. When anticholinergic drugs block that signal, thinking can feel like moving through syrup. In younger brains, the system is resilient and often bounces back. In older brains, the reserve is lower. The same blockade that felt like a harmless convenience at 35 can feel like heavy fog at 70. This is why adults in their 60s and 70s are more sensitive to these medications, and why even over-the-counter products deserve respect. You don't have to memorize a pharmacology textbook to protect yourself. All you need is a practical, repeatable routine for spotting the usual suspects and asking better questions. Start by gathering every product you use weekly, not just daily. That includes prescription bottles, over-the-counter bottles, seasonal allergy boxes, motion sickness tablets you keep for travel, sleep aids, old cough and cold capsules, and any leftover pills from previous injuries or dental procedures. Place everything on a table and turn the labels so you can read them easily. This is your personal brain health audit, and it takes less than 20 minutes. Now scan the active ingredients. The classic anticholinergic names many people recognize are diphenhydramine and doxylamine, common in nighttime sleep aids and older allergy pills. In the bladder category, Look for oxybutynin and tolterodine, among others. Older antidepressants, like amitriptyline and imipramine, can be strongly anticholinergic, and they are sometimes prescribed at low doses for pain or sleep. Some anti-nausea and antispasm drugs carry similar properties. If you see one of these names, pause. If you see 2 or 3 across different products, that's a red flag for cumulative burden. Remember, no panic, curiosity first. There is a second layer that matters: how often you use them and at what dose. An occasional travel tablet for a boat trip is not the same as a nightly sleep aid or a daily bladder pill. The brain is most vulnerable to regular exposure. So ask yourself with each product, do I use this daily, weekly, monthly, or only as needed a few times a year? You're not only identifying ingredients, you're measuring frequency. That simple awareness already puts you ahead of where most people are. Let's talk about sleep aids, because this is where many men and women accidentally accumulate risk. The blue or green box that promises deep sleep often relies on an older antihistamine with strong anticholinergic effect. The next day, you pay the price in dulled focus, slower reactions, and a heavy head. Over weeks and months, the brain practices sleeping under the influence rather than learning to produce its own rhythm. There are safer paths that don't sabotage acetylcholine. A wind-down ritual with low light, a consistent sleep and wake time, gentle breath work, and a short walk after dinner changes more than it sounds like it should. If you need structured support, cognitive behavioral therapy for insomnia is a practical, skills-based program that helps your brain remember how to sleep. When people transition away from sedating antihistamines to behavioral tools or to non-anticholinergic options, they often describe a quiet surge in morning clarity they didn't realize they were missing. Allergies are another common source. In many countries, you can still buy first-generation antihistamines over the counter, and people choose them because they work fast. They do, but they do it by blocking acetylcholine along the way, making you drowsy and dry. Newer, non-sedating antihistamines are designed to spare the brain from that effect. If you live with seasonal allergies and reach for an old favorite, consider asking your clinician or pharmacist about modern options that calm your nose without clouding your mind. This single swap lowers your burden all season long. Let's look at bladder medications, because urinary urgency and nighttime trips to the bathroom are among the most disruptive issues after 50. Many overactive bladder drugs are anticholinergic because they relax bladder muscles by blocking the same messenger we're trying to protect in the brain. For some people, they are helpful and appropriate, but many others do well with non-drug strategies and alternatives that target the root problem without adding cognitive risk. Training the bladder with scheduled voiding, reducing bladder irritants like strong caffeine late in the day, pelvic floor physical therapy to teach the muscles to relax and coordinate, and attention to fluid timing can reduce urgency more than you might expect. If a medication remains necessary, there are options in a different class that act on a separate pathway. That conversation is worth having if you value both bladder comfort and long-term clarity. Pain and sleep are a tricky pair. Some older antidepressants are prescribed in tiny doses at night to help with nerve pain or insomnia. They can be effective for some people, but they also carry anticholinergic effects that add up over the years. If you use one for sleep because it knocks you out, that is a sign it is acting on the very system we are trying to protect. When people transition to pain-focused strategies, movement, and sleep skills, they sometimes discover that their pain is more manageable and their mornings are brighter. It's not always easy, and changes should never be abrupt, but the payoff for brain health is real. I want to share a simple picture that helps people make sense of all this. Imagine your brain as a city at night. Acetylcholine is the streetlight system that keeps intersections bright, so cars can navigate smoothly. Anticholinergic drugs dim the bulbs. One street goes a little darker, then two. Add a second product, and you dim 3 more blocks. You can still drive, but you are more likely to miss a turn or hesitate at an intersection. Over time, living in the dimness becomes normal. When you replace one medication with a safer option and remove a second that you no longer need, it's like replacing bulbs. The city looks different. You see details you forgot were there. People often tell me they feel like themselves again within weeks of lowering their anticholinergic load. Let's build a plan you can follow without stress. Pick 1 week to do your audit. Place your products on the table and circle the ones that might carry anticholinergic effects. Choose one to address first. If it's an over-the-counter sleep aid, start by cutting it to every other night while you build a wind-down routine and morning light exposure. Use a small notebook to track how many nights you sleep and how you feel on waking. If allergies are your main issue, ask your pharmacist to recommend a non-sedating option and switch for 2 weeks. If bladder urgency is the sticking point, begin with evening fluid timing, a short after-dinner walk, and a relaxation practice that softens the pelvic floor instead of bracing it. This is not all or nothing. It's one decision at a time. I also want you to know what to watch for during the transition. The most common changes people notice when they reduce anticholinergic load are improved morning alertness, steadier attention in the afternoon, easier word finding and conversation, fewer episodes of confusion after naps, and better balance. You may also notice brighter mood. The brain loves when you lighten its workload. If you have been using sedating products at night, expect an adjustment period. You're teaching your brain a new rhythm. Stick with the wind-down ritual and give yourself 2 to 4 weeks to stabilize before you judge the results. Let me offer 3 short stories, not as promises, but as possibilities. 67 used a nighttime allergy pill for sleep for almost a decade. She felt safe with it because it was over the counter. When she learned about anticholinergic burden, she switched to a non-sedating allergy tablet during the day only when needed, started a 15-minute wind-down with a warm shower and dim lights, and used a simple breathing pattern in bed. She didn't sleep perfectly every night, but within 3 weeks she felt sharper in the morning and less groggy during her walks. Her comment surprised me. She felt more patient with her grandchildren because her mind was less foggy. Michael, 72, had urgency and used a bladder-relaxing medication with good effect, but increasing forgetfulness. On review, he had accumulated several anticholinergic exposures, including a motion sickness tablet he took every few days for a dizzy sensation and a sleep aid most weekends. With his clinician, he tapered the sleep aid, stopped the motion sickness tablets in favor of a different approach, and shifted to a non-anticholinergic bladder option while adding pelvic floor therapy. His urgency remained controlled, and his family noticed he told fewer repetitive stories at dinner. He said the best part was feeling more in control of his choices. Rosa, 64, took a low dose of an older antidepressant for pain and sleep. It helped, but her focus at work suffered. With her physician, she transitioned to a pain plan that combined targeted movement, a non-anticholinergic option for sleep during a short bridge period, and stress strategies that made evenings calmer. She tracked her mornings. After a month, she described her brain as crisp again. She kept the notebook to remind herself that small changes add up. Since many of you ask for specifics on what to do tonight, here is a simple evening sequence that supports brain chemistry without adding burden. 2 hours before bed, dim screens and room lights. 1 hour before bed, take a short, slow walk or do gentle stretches. 15 minutes before bed, sit in a chair, inhale slowly through your nose for 4 counts, and exhale through your mouth for 6 counts. Keep the exhale longer than the inhale for 10 rounds. In bed, keep your phone out of reach and let your breath feel like a slow tide. If your mind races, notice the thoughts and return to the breath. This is a skill you build like any other. If you wake in the night, sit up, sip water if needed, and repeat the same breath pattern for 2 minutes. The goal isn't instant sleep, the goal is calm, which is the on-ramp to sleep. If you feel unsure about changing long-standing habits, involve your care team. Pharmacists are an underused ally in brain health. Bring your bag of products and ask directly, which of these increase anticholinergic burden and what are my safer alternatives? If a medication is essential for your condition, your clinician can help you minimize dose, duration, and interactions. If a taper is needed, do it gradually and with guidance. Stopping some pills abruptly can make you feel worse, and that leads people back to the very products they were trying to leave behind. Slow and steady wins here. There's a final mindset shift that matters. Many adults in midlife and beyond carry a quiet belief that decline is inevitable and that brain fog is simply the price of getting older. That belief is one of the heaviest burdens you can carry. The truth is more hopeful. The brain remains plastic. It responds to light, movement, sleep regularity, social connection, mental challenge, and yes, to the removal of unnecessary blockers. When you lower the anticholinergic load, it's like opening a window in a stale room. Fresh air moves in. The light looks different. You still have responsibilities and stress, but you operate with more clarity. Clarity changes how you solve problems. It changes how you talk to your loved ones. It changes how you feel about your future. If you need one sentence to take with you, let it be this: the worst medicine for your brain is the hidden one you take without noticing, and the smartest step is replacing it with an option that protects your clarity. That is how you become the steady guardian of your mind, day after day, season after season. If this talk helped you see your medicine cabinet with fresh eyes, choose one product to review this week and make one safer swap. If you know someone who has been struggling with fogginess, share this message so they can audit their own shelf. And if you want more calm, practical guidance on brain longevity without scare tactics or hype, subscribe so we can keep learning together in a way that respects your intelligence and protects your future self. Disclaimer: this is educational content, not medical advice. Do not stop, start, or change any medication without talking with a qualified clinician who knows your history. Some drugs require tapering to avoid withdrawal or rebound symptoms. If you experience acute confusion, sudden weakness, severe headache, or new neurological symptoms, seek urgent care.